General surgery has come a long way. With robotic surgery, we have improved patient outcomes. I'm Jesse Gray with Salina Regional Surgical Associates.
Dr. Gray, thank you so much for coming on the show. We're going to be talking about general surgery. As a general surgeon, wanted you to tell us kind of how surgery has evolved throughout time.
So general surgery has evolved throughout time. It's evolved in the techniques and the way we're able to approach surgery. It used to start off with a large incision in order to be able to achieve the desired effect. Then we started having more minimally invasive procedures through laparoscopy in the 70s and 80s through small, tiny incisions. Today we're able to do these through robotic surgery.
Okay, in looking at robotic surgery, what type of surgeries are you using the robot for?
We use the robot nowadays to do almost every surgery that we have done open throughout the years. We use the robot to perform cholecystectomies, large hernia repairs, abdominal wall reconstruction, colon resections, you name it.
Okay, let's talk a little bit about how the surgeries are done, because it's important to know you're still doing the surgery. The robot's not doing the surgery.
Yeah, so there's no magical button that I walk over and push and say cholecystectomy and the gallbladder comes out. It's us using this robot as a tool, right? Think of it like a skid steer. You have two joysticks and you have some foot pedals. It's the same thing. We have a console that we sit at while we're operating, while the machine does exactly those motions and movements that we're doing at the console.
Okay. In talking before, I asked you the question: do you prefer doing it that way, or do you have more control with the robot? And you really do, don't you?
I feel like you have more control with the robot because you're able to bring this marriage of this open surgery technique along with minimally invasive procedure. The huge transition between open to laparoscopy was that felt like there was too much disconnect from the patient. And then a lot of hesitation for some providers is that disconnect gotten even greater because now there's a distance between you. You're not standing directly over the patient. Well, I think that disconnect goes away with the comfort that you feel while you're operating, knowing that you can provide that patient with open surgery techniques in a minimally invasive platform.
Let's look at some of the advantages of performing the surgery this way.
Robotic surgery provides a great advantage to our patients because we're able to perform minimally invasive surgery, decrease post-operative pain, and decrease length of stay in the hospital.
Dr. Gray, thank you so much for coming on the show and for some great information, and thank you for watching. For more information, please visit the Surgical Services tab of srhc.com and like us on Facebook, follow us on Twitter and Instagram.